Okay, we're going to show you some new work based on the 3D and on the 2D done by Arshad Alam, who is the executive manager of ANPA Medical. He has a great experience in using the different software we developed, including AxisGuide. So the issue is the following. In some cases, you need to work on the teeth and on the bone. As long as you overlay the plaster cast of the patient over the CT scan of the patient, you will involve the teeth and the soft tissue at the same time. For this reason, you are not able to work on teeth and bone, and this was impossible until Arshad Alam has been able to find a way to do it. So what you see on that 2D, you see that we have the teeth and we have the bone. But the guide is not designed on that because of the quality of the CT scan. The teeth are not perfectly shown in the 2D and in the 3D. So what is being added is the cast of the patient. And you see the cast has been overlaying, and now you see that the surface of the soft tissue is in that. But we don't want the soft tissue. We need to remove the soft tissue. How can we do that? We're going to cut the surface of the soft tissue from this overlay. So he's going to use a tool, which is this tool, and he's going to remove the soft tissue where we want to work directly on the bone. So now he's going to link these two images, and he's going to make an image which will at the same time will cover the teeth, support on the teeth, and support on the bone. Doing that, we change the program. We cannot do it in the same program. We need to work in a different program. And we have the two images, the image of the bone and the image of the teeth. So based on this, he will design a new support, and this here, and he's going to be able to design a guide which will be supported on the teeth in front and at the back, and also supported directly on the bone where you want to place the implants. For that, you will elevate the flap, you will adapt and put your teeth laying on the teeth only, and then you will drill and place that in the exact right position. So to show you the part that you will do in the patient's mouth, we are going to show you now how we do in a real case with a cast which has been done on a 3D model, and with a guide which has been done on a 3D model also. Let's go to the next step. I am going to show you the model which has been done based on the design of what Arshad did. Okay, so what you see here, you see the gum, you see the tooth, and here is the bone. Is the exact shade of the bone. On the other side, you see again the bone here and the soft tissue. So he's been able to separate the teeth, the soft tissue, and the bone. So that is exactly what you will have in the patient's mouth when you will open a flap, elevate the flap, and then you will get access to the bone and access to the teeth on right and left side. Now, look at the guide. This is the surgical guide. The surgical guide is the fully surgical guide for the drills. It's you have the metal cylinders, you have the support on the existing teeth, and he's been making a hole here to check that you are in a fully down to the bottom position when you place the guide. So this is what we are going to do. We are going to show and place the guide in the exact right position. We can check here that we are fully down to the bottom, and we have the position of the drill. So now we are going to take a spoon. The spoon has been designed in the full system, full guided system. So the spoon is in place, and we are going to drill one drill after the other. We are going to drill in the exact right position, and we are going to check if the system is accurate or not. Doing that
on a plaster, on a model before doing in the patient's mouth. As you will see, I remove here, and you see that the drill is going to come here. What is the size of the drill? It is based on the guidelines which are delivered, including with the guides. So we are going to drill and show you the result. Okay, so using the multi-drill kit, we have been able to drill guided inside this position and this position. So you see the holes here, okay? You see on the other side. And when we open and we remove the surgical guide, you can see that the implants are exactly placed where they have been planned. So remember this image, we are going to show you the image on the 3D. Okay, what we can say is that the accuracy is of course very important, but the accuracy is linked to the surgical guide. But the advantage of working with an open flap and guided at the same time, laying on the teeth, will avoid contamination of the implant when you place it through the gum. So this is very important. And in some cases, you may lose implant because you are placing the implant which is contaminated through the soft tissue. So this technique developed by Arshad Alam will allow avoiding that and making more secure implant treatment. Thanks for your attention.